Garmagad. Thanks for the time as well. Welcome to the Minister to the House today. And I suppose it's great. I understand, I suppose, the mandatory hotel quarantine, it was going to lapse very shortly, the 7th of June. So we're here today, I suppose, about an extension of that legislation, as you've mentioned, to the 31st, I believe, of July, is that right? And I suppose we've seen how important this is. Minister, in your opening statement, you mentioned that there were potentially 59 identified cases, and that doesn't include asymptomatic, which of course accounts for nearly 30 to 40% of all COVID cases. We know that there's been a fall in detection of the variants of concern, as has been mentioned, since we've introduced mandatory hotel quarantine. And the reasons for all of this was just, we were in such a vulnerable situation, and we have reduced the risk. It was about keeping people safe, keeping people healthy, and it was very important to do it at that time. I also note clearly that you have removed the countries, as Senator Burke has mentioned, France, Belgium, Luxembourg and the US. Very important, particularly as I was having representations, particularly from organic farms, where they would have used seasonal workers and students, in the summertime. So I think that's been really important. I suppose if I could just account for, over education, as a spokesperson in education, very happy to see that for Erasmus Plus, that the Department for Further and Higher Education is covering the cost for those students that may have to go into mandatory hotel quarantine. I suppose combined with the government vaccination rollout, and as you've mentioned as well, 2.7 million vaccines rolled out already, half of the adult population. It's absolutely incredible. When you think of everything the HSE has been through, it's amazing, and I think particularly important that they kept that separate within the HSE, that it hasn't been so impacted by the HSE cyber attack, even now that HSE emails still aren't working, One of the questions I might have, Minister, and we may have mentioned it just a little bit briefly earlier, but in relation to the health identifiers, these unique numbers that are now been allocated, we're now able to use the vaccination rollout as a way to drive that forward. Your own department has allocated huge funds towards IT, particularly in the health sector, and it's so needed, probably because I've worked before and we were always trying to fight for electronic health records. But now they're looking at sharing care records and how that can be really brought forward. So just if you would like to comment a little bit on that in your response, I'd really appreciate it. Just from the 19th of July, you've mentioned the digital COVID certificate for aviation. This will be so crucial. We have heard so many times from the groups, and everyone has seen the groups protesting as well outside of the House here. The impact to incomes has been shocking, and by doing this, we're going to have a chance to get that sector of economy back up and going again. I suppose just to acknowledge, Minister, the work that you're doing, your department and your officials, to thank you for the time, and I suppose, we're all looking forward to getting our vaccine and to moving into a safer place, and thank you for that, and to the teams within the HSE in achieving that. Garmagad.